Hello everyone, I'm Dr. Helen Miller, and I've been practicing neurology for just over 40 years now. I'm 70 years old myself, so I understand the concerns many of you have about your health as we get older. Today I want to talk with you about stroke, specifically, about recognizing the warning signs early enough to do something about them. This is information I wish every one of my patients knew, because I've seen too many people come into the emergency room too late. I'm not here to sell you anything. I'm not promoting any products or supplements. I'm simply a neurologist who's treated thousands of stroke patients, and I want to share what I've learned over 4 decades of practice. Let me start with some context. Stroke is the 5th leading cause of death in the United States, and it's one of the leading causes of long-term disability. Every year, about 795,000 Americans have a stroke. That's roughly one person every 40 seconds. Now, those numbers might sound frightening, but here's what I want you to focus on. Research shows that up to 80% of strokes are preventable. Not all of them, certainly. There are genetic factors, and sometimes just bad luck, but the majority can be prevented if we recognize the warning signs and act quickly. The problem I see in my practice, over and over again, is that people either don't recognize the warning signs, or they recognize them and decide to wait. They think, maybe it's nothing. I don't want to overreact. I'll see how I feel tomorrow. And that delay, that decision to wait, often makes the difference between a good outcome and a devastating one. Before we talk about warning signs, let me explain what actually happens during a stroke. I think understanding the mechanism helps people take the symptoms more seriously. A stroke occurs when blood flow to part of your brain is interrupted. Your brain cells need a constant supply of oxygen and nutrients from your blood. When that supply is cut off, even for a few minutes, brain cells start to die. There are 2 main types of strokes. The most common type, accounting for about 87% of all strokes, is called an ischemic stroke. This happens when a blood clot blocks a blood vessel in your brain. Think of it like a clog in a pipe. Blood can't get through to the brain tissue beyond that blockage. The second type is a hemorrhagic stroke, which happens when a blood vessel in your brain ruptures and bleeds. This accounts for about 13% of strokes, but it's often more severe. Both types are serious medical emergencies. And here's the critical thing to understand: brain cells don't regenerate the way other cells in your body do. Once they're dead, they're gone. The functions they controlled, movement, speech, memory, sensation, may be permanently lost. That's why time is so crucial. The faster we can restore blood flow to your brain, the more brain tissue we can save, and the better your recovery will be. Now, most people have heard of the FAST test for recognizing stroke. Face drooping on one side, arm weakness, speech difficulty or slurred speech. Time to call 911. This is good information, and I'm glad it's been widely publicized. But what many people don't know is that stroke warning signs often appear earlier and more subtly than this, and they frequently show up in the legs first. Why the legs? Because the parts of your brain that control leg movement and sensation are supplied by specific blood vessels. When those vessels start to fail, your legs are often the first to signal that something's wrong. Let me be very specific about what to watch for. First, sudden weakness in one leg. This is not the tired, achy feeling you get after walking around all day. This is completely different. One leg suddenly feels heavy, like it doesn't quite belong to you. You might be walking to get the mail and your left leg just gives out. Or you're going upstairs and your right leg won't lift properly. It comes on suddenly, without any warning, and it affects only one leg, not both. Second, numbness in one leg or foot. Again, this isn't the pins and needles sensation you get when your foot falls asleep. This is a deep, complete numbness where sensation is just gone. You might step on something and not feel it, or you notice one leg feels cold when the other one is warm. Typically, it's just one side. Third, dragging one foot when you walk. You might not even notice this yourself. Often a family member points it out. Your husband might say, "You're dragging your left foot a little." Or your daughter mentions it when she visits. One foot doesn't lift quite high enough as you walk, so it scrapes along the ground. You catch your toe on carpets. You trip over small curbs you normally wouldn't even notice. Fourth, unexplained stumbling or loss of balance. You're walking across your living room. The floor is perfectly flat, nothing to trip over, and suddenly you stumble. Or you lose your balance for no apparent reason. This isn't just clumsiness. It's a sign that your brain's coordination centers may not be functioning properly. Fifth, difficulty walking steadily. You feel unsteady on your feet, like you've had too much wine, but you haven't had anything to drink. Your gait becomes wobbly. You weave side to side. You need to hold onto walls or furniture to stay upright. Now here's the warning sign that's actually the most dangerous. Because it tricks people into thinking everything's fine, symptoms that appear and then disappear. Your leg goes weak for 5 minutes, then it's normal again. You feel numbness that fades away. You stumble, then you're steady again. This disappearing act makes people ignore the warning. They think, well, I'm fine now, so it must have been nothing. But this is not nothing. This is what we call a transient ischemic attack, or TIA. Some people call it a mini stroke, but I really dislike that term because there's nothing minor about it. A TIA is essentially a stroke that resolves on its own, usually within a few minutes to an hour. What happens is that a blood vessel in your brain gets temporarily blocked. Maybe by a small clot that then breaks up, or by a spasm in the vessel that then relaxes. Blood flow is restored, the symptoms go away, and you feel completely normal again. But here's what the research shows, and I need you to really hear this. About 10 to 15% of people who have a TIA will have a full stroke within the next 48 hours. Within 2 days. And about 1/3 will have a stroke within a year. A TIA is not your body recovering. It's not a close call that you escaped. It's your body giving you a final warning that something is seriously wrong and needs immediate attention. I had a patient, I'll call him Robert, who was 69 years old. Retired, active, enjoying his retirement. One Sunday morning, his left leg went numb for about 5 minutes while he was reading the paper. His wife wanted to call 911. He said no, told her not to overreact, that he was fine now. 2 days later, he had a massive stroke. By the time the ambulance got to him, he'd been unconscious for at least 20 minutes. We did everything we could, but the damage was extensive. Robert survived, but he never walked independently again. He requires assistance with most daily activities now. That Sunday morning numbness was his warning. If he had come to the hospital then, we could have done imaging, found the problem, started treatment, and very likely prevented the major stroke. But he waited, and that decision to wait cost him his independence. I've had this conversation with patients and their families hundreds of times. The regret is profound. We should have called. I should have insisted. If only we'd known. That's why I'm talking with you today. So you'll know. Let me walk you through what happens when someone with stroke symptoms arrives at the emergency room. Because understanding this process will help you see why every minute counts. The moment the ambulance radios ahead that they're bringing in a possible stroke patient, the entire stroke team is activated. This includes me or another neurologist, the emergency department physicians, radiologists, and often a neurosurgeon. We have something called door-to-needle time. Our goal is to evaluate the patient, get imaging done, and start treatment within 60 minutes of arrival. At our hospital, we usually do it in under 45 minutes. When the patient arrives, we immediately do a neurological exam. We check their mental status, their speech, their ability to move each limb, their facial symmetry, their coordination. This tells us which parts of the brain are affected. But the most critical question we ask is this: when exactly did the symptoms start? Not when you decided to come to the hospital. Not when you called 911. When did you first notice something was wrong? This timing determines everything. For ischemic strokes, the clot type, we have a medication called tissue plasminogen activator, or TPA. This is a clot-busting drug that can literally stop a stroke in its tracks. But we can only give it within 4.5 hours of symptom onset. After that window, the risks outweigh the benefits. For certain patients with large vessel blockages, we can do a procedure called mechanical thrombectomy, where we thread a catheter up through the groin and physically remove the clot from the brain. We can sometimes do this up to 24 hours after symptom onset, but again, earlier is always better. The longer blood flow to the brain is interrupted, the more brain tissue dies. We have a saying in neurology, time is brain. Studies show that during a stroke, about 1.9 million neurons die every minute. Every minute we can shave off that time to treatment potentially means better function preserved. But if someone comes in and says their symptoms started 3 days ago, or even yesterday afternoon, we've often missed that window. We can still prevent another stroke from happening, but we can't undo the damage that's already occurred. This is why I emphasize, again and again, if you experience any of these warning signs, call 911 immediately. Don't wait to see if it gets better. Don't call your daughter to ask what she thinks. Don't decide to rest for a bit first. Call 911 right then. Even if the symptoms go away completely, especially if they go away completely, you still need to be evaluated immediately. That's a TIA, and it means you're at very high risk for a major stroke in the next few hours or days. I mentioned the FAST test earlier. I want to give you an expanded version that includes leg symptoms. Let's call it FAST-L. F is for face. Look in a mirror and smile. Does one side of your face droop or not move as well as the other? A is for arms. Raise both arms straight out in front of you. Does one arm drift downward or feel weak? S is for speech. Say a simple sentence out loud, something like, "The sky is blue." Is your speech slurred or strange? Do you have trouble getting the words out? T is for time. If you see any of these signs, it's time to call 911 immediately. L is for legs. This is my addition. Check for any of those leg warning signs I described earlier: weakness, numbness, dragging, loss of balance, stumbling. And here's something important: you don't need to have all of these signs to call 911. If you have even one of them, that's enough. Don't wait to see if you develop other symptoms. One is enough. When you call 911, be as specific as possible about what you're experiencing. Say exactly what happened. My left leg suddenly went weak and I almost fell. My right foot has been dragging for the past hour. I had numbness in my leg that lasted about 10 minutes and then went away. And look at a clock and note the exact time. Tell the dispatcher when the symptoms started. This timing is absolutely crucial for treatment decisions. Now, I want to teach you something I do myself every single morning. It's a simple 5-minute routine that helps me monitor my own neurological function. I'm 70 years old. I'm at risk for stroke too. So I pay attention. Think of this as a baseline check. You're not looking for chronic issues you already know about, like arthritis you've had for years. You're looking for changes. Things that feel different today compared to yesterday or last week. Check 1. Stand up from a chair without using your hands. I do this first thing in the morning. I sit in my bedroom chair and then stand up, without pushing off the armrests, without using my hands for help. And I pay attention to how it feels. Do both legs feel equally strong? Or does one feel weaker, heavier, less responsive? Check 2. Balance test. I stand next to my dresser, something I can grab if I need to, and I close my eyes and try to stand still for 30 seconds. Do I feel steady, or am I swaying more than usual? This tests your cerebellum, the balance center of your brain. Check 3. Check sensation in both feet. I sit on the edge of my bed and press on different spots on each foot. The ball of the foot, the heel, the toes. Does each foot feel the same? Or is one less sensitive, more numb, colder? Check 4. Walk a straight line. I use the grout lines in my bathroom tile. I walk heel to toe along a line for about 10 steps. Can I stay on the line? Do I veer to one side? Is the heel to toe motion easy to maintain? Check 5. Notice any changes. This is actually the most important check. Not how you feel in general, but whether anything has changed from yesterday. Did your left leg feel fine yesterday but weak this morning? Was your balance steady yesterday but shaky today? I do this entire routine right after I brush my teeth in the morning. It's become automatic, part of my routine. The whole thing takes maybe 5 minutes. If I notice something concerning, if something feels different or off, I don't ignore it. I call my primary care doctor that same day. I describe exactly what feels different. Sometimes it turns out to be nothing. Sometimes it leads to further testing. But I'd rather check it out than miss something important. This isn't being a hypochondriac. This is being appropriately vigilant about your health at an age when stroke risk increases. Let me talk for a minute about risk factors, because understanding your personal risk helps you know how vigilant you need to be. Some risk factors you can't control. Age is one. Stroke risk increases as we get older. Family history is another. If your parents or siblings had strokes, your risk is higher. Race plays a role too. African Americans have a higher stroke risk than other groups. But many risk factors are controllable. Let's talk about the big ones. High blood pressure is the single most important modifiable risk factor for stroke. When your blood pressure is consistently elevated, it damages blood vessel walls over time. They become stiff and prone to rupture, which can cause a hemorrhagic stroke. High pressure also promotes the buildup of cholesterol plaques, which can lead to ischemic strokes. If you have high blood pressure, it's critical to keep it well controlled. That usually means medication, but it also means lifestyle factors, reducing sodium, maintaining a healthy weight, regular exercise, managing stress. Diabetes significantly increases stroke risk. High blood sugar damages blood vessels throughout your body, including in your brain. If you have diabetes, work closely with your doctor to keep your blood sugar well controlled. High cholesterol promotes the buildup of plaques in your arteries. These plaques can rupture and cause clots, or they can narrow arteries so much that blood flow is severely restricted. Atrial fibrillation, an irregular heart rhythm, is a major cause of stroke. When your heart doesn't beat regularly, blood can pool and form clots. These clots can then travel to your brain. If you have atrial fibrillation, you probably need to be on a blood thinner. Smoking damages blood vessels and makes your blood more likely to clot. If you smoke, quitting is one of the best things you can do to reduce your stroke risk. Now, you should know your numbers. Do you know your blood pressure? Your LDL cholesterol? Your hemoglobin A1C if you have diabetes? If you don't know these numbers, make an appointment with your doctor and find out. These aren't just abstract lab values. They're concrete indicators of your stroke risk. And the good news is that all of them can be improved with treatment. I'm often asked about diet and stroke prevention. Let me be clear about what the evidence shows, and what it doesn't show. No single food is going to magically prevent strokes. And no single food is going to cause one. What matters is your overall dietary pattern over time. That said, there are certain foods that research has linked to better vascular health, and others that are associated with increased stroke risk. Foods associated with lower stroke risk. Fatty fish like salmon, mackerel, and sardines are high in omega-3 fatty acids. Multiple studies have shown that people who eat fish regularly have lower rates of stroke. The omega-3s appear to reduce inflammation, lower triglycerides, and may help prevent blood clots. Leafy green vegetables like spinach, kale, and collard greens are high in potassium, which helps regulate blood pressure. They're also rich in folate and other B vitamins that may protect blood vessels. Whole grains, things like oatmeal, brown rice, whole wheat bread, are associated with lower stroke risk in large population studies. They help control blood sugar and cholesterol. Berries, particularly blueberries and strawberries, contain compounds called flavonoids that appear to have protective effects on blood vessels. Foods to limit. High sodium foods are a problem because excess sodium raises blood pressure. The biggest sources in the American diet aren't the salt shaker, they're processed and restaurant foods. Canned soups, frozen dinners, deli meats, chips, pickles. Check labels and choose lower sodium options when possible. Processed meats like bacon, sausage, hot dogs, and deli meats have been linked to increased stroke risk in several studies. We're not entirely sure why, but it may be related to their high sodium content, saturated fat, and preservatives. Foods high in trans fats and saturated fats can raise your LDL cholesterol and promote inflammation. This means limiting fried foods, baked goods made with shortening, and fatty cuts of meat. Now, I'm not saying you can never have bacon again, or that you need to eat salmon every day. I'm talking about general patterns. What are you eating most days? What's your usual diet like? Small, consistent changes add up over time. If you currently eat fast food most days, could you cook at home more often? If you rarely eat vegetables, could you add a salad or a side of broccoli to dinner? If you eat processed meat daily, Could you choose fresh chicken or fish instead a few times a week? These don't have to be dramatic, all or nothing changes. Gradual improvements to your overall diet can make a real difference. People often ask me about supplements for stroke prevention. Let me give you my honest opinion as a neurologist. For most people, the best approach is to get your nutrients from food rather than pills. The research on supplements is much less clear than the research on dietary patterns. That said, there are a few exceptions. If you have documented nutrient deficiencies, like low vitamin D or low B12, then supplementation makes sense. If you don't eat fish, an omega-3 supplement might be reasonable. If you have certain medical conditions, your doctor might recommend specific supplements. But I see patients all the time who are taking 10 or 15 different supplements they've read about online or that friends have recommended. They're spending hundreds of dollars a month on these products. And there's very little evidence that this shotgun approach to supplementation does any good. More importantly, some supplements can actually be harmful, especially if you're on other medications. For example, if you're on blood thinners, taking high doses of vitamin E or fish oil could increase your bleeding risk. Talk to your doctor about any supplements you're considering. Bring in the bottles. Make sure there aren't any interactions with your medications. And be realistic about whether the evidence supports what you're taking. If you do have a stroke or a TIA, what happens after you leave the hospital is just as important as the immediate treatment. We'll typically start you on medications to prevent another stroke. This might include a blood thinner like aspirin or clopidogrel, or a stronger anticoagulant if you have atrial fibrillation. We'll give you medication to control your blood pressure and cholesterol. But taking these medications consistently is crucial. I have patients who stop taking their medications because they feel fine, or because they don't like the side effects, or because they can't afford them. And then they end up back in the hospital with another stroke. If you're having side effects from a medication, call your doctor. Don't just stop taking it. Often we can adjust the dose or switch to a different medication. If cost is an issue, tell us. There are often less expensive alternatives or patient assistance programs. You'll also need regular follow-up appointments to monitor how you're doing, adjust medications if needed, and watch for any complications or new symptoms. Some people will need rehabilitation, physical therapy to regain strength and mobility, occupational therapy to relearn daily tasks, speech therapy if speech was affected. This rehabilitation is hard work, but it's essential for maximizing your recovery. If you've had a TIA or a minor stroke, you might be feeling scared or anxious. That's completely understandable. You've had a frightening experience, and you're worried it might happen again. Let me tell you what I tell my patients: having a TIA or stroke does increase your risk of having another one. But that risk is not inevitable. With proper treatment and lifestyle modifications, many people never have another event. The key is taking your health seriously from this point forward. Taking your medications consistently, following up with your doctors, making those dietary changes we talked about, staying physically active, managing stress. Some people tell me they feel like they're living with a time bomb, waiting for the next stroke to happen. I understand that fear, but try not to let it consume you. You have agency here. You have control over many of the factors that determine your risk. At the same time, be vigilant. Pay attention to your body. Do those daily checks. And if you experience any new symptoms, get help immediately. Don't wait because you're embarrassed or because you don't want to bother anyone. Your health and independence are worth protecting. If you're watching this because someone you care about has had a stroke, I want to acknowledge how difficult this is for you too. Caring for a stroke survivor can be physically and emotionally exhausting. You might be helping with basic activities like dressing and bathing. You might be managing multiple medications. You might be providing emotional support while dealing with your own fear and grief. Please take care of yourself too. Accept help when it's offered. Look into respite care so you can take breaks. Consider joining a support group for caregivers. Talking with others who understand what you're going through can be incredibly valuable. And learn the warning signs yourself. You might be the one who notices subtle changes that indicate another stroke might be developing. I've been a neurologist for over 40 years, and I've treated thousands of stroke patients. I've seen every kind of outcome, from complete recovery to devastating disability to death. What I can tell you is this: the people who do best are those who take warning signs seriously and act quickly. The ones who have the worst outcomes are almost always the ones who waited. I understand the tendency to minimize symptoms. I understand not wanting to overreact or bother anyone. I understand being scared of what you might find out. But I've held too many hands of patients and families who are dealing with the aftermath of a devastating stroke, knowing that if they had just called 911 when those first symptoms appeared, everything might be different. You can't control everything. You can't eliminate all risk. But you can be informed, you can be vigilant, and you can act quickly when something's wrong. Know the warning signs. Do those daily checks. Keep your risk factors controlled. And if something feels suddenly different, if your leg goes weak, if you feel unexpectedly unsteady, if you stumble for no reason, call 911. Don't wait to see if it gets better. Don't call your kids first to ask what they think. Don't decide to rest for a bit and see how you feel. Call 911. Right then. Your brain can't wait. Your independence can't wait. Your life can't wait. I hope this information has been helpful to you. If you have specific questions about your own health or risk factors, make an appointment with your doctor. Bring this information with you if you'd like. Have that conversation about your stroke risk and what you can do to reduce it. Stay well, pay attention to your body, and don't hesitate to get help when you need it. Thank you for listening.